So, hi, welcome. Welcome to this session of an introduction to Buddhist chaplaincy. Introduction to Buddhist chaplaincy. Um, so, I'd like to begin by just getting a sense of who's here. Actually, before I do that, I'm going to begin by quite more politely introducing myself because you're like, who is this woman who is speaking? My name is Vanessa Abel, and I am the leader of the online Buddhist chaplaincy training program. And my colleague and friend Jennifer is here, Jennifer Block. She's with us too. And Jennifer is a faculty member of the in-person Buddhist chaplaincy training program. Okay. So the two of us will be presenting to you today, and I'll tell you in a moment a little bit more about what's coming this morning. But first, I would love to hear from you in the chat because there's so many of us. Unfortunately, I just think we wouldn't have time for us all to speak. But perhaps you'd like to jot down in the chat, what is it that brings you here today, and where are you coming from? Because I have a sense that we might be coming from all over the country, maybe even beyond the United States. I will say that I'm coming from France today. I actually live in France. So that is the miracle of technology, that we can all be here together, so many thousands of miles away. So please do put in the chat, what brings you here today, and where are you coming in from? Let's see. So I'll try and read a few of these out loud. So sickness and death bring me here in the most beautiful way, coming from Calgary, Alberta. Curiosity from Iowa. Curiosity from New Jersey. Loveland, Colorado. Interested in changing vocational orientation. Phoning in from New Haven, Connecticut on a flyby visit. Exploring the expectations of chaplaincy from Normal, Illinois. My husband used to work there in Normal, Illinois. Portland, Oregon, taking interest in taking my practice to a deeper level. Been curious about chaplaincy for years. Lauren from Marin. From Bellingham, Washington State. I think I've always wished I was involved in something like chaplaincy. Eva, coming from Oro-Medonte, if I said that right, Ontario, Canada. Toes in the water, lovely. Always wanted to assist dying, Canada. Education and interest, Toronto. Lots more curiosity from Ohio, Cleveland Heights. Sacramento, exploring the possibility of becoming a Buddhist chaplain, coming from Ventura, California. Portland, Oregon again. Oh my goodness, so many. Mountain View, Bend, Oregon. See how serious my desire to get into chaplaincy is. If I make it through 3 hours talking about it, that's a good sign. I would say so, David. Definitely. I think if we can all make it through the next 3 hours, we'll be doing well. On a Saturday morning. Greetings from Cannon Beach, Oregon. Curious, Santa Cruz. So it seems like we're coming from all over. Eugene, Oregon, and the Kalapuya lands. Coming from a place of listening. Beautiful. I'm sorry if I've missed anybody. I'm trying to scroll through these. Palms Together in Florida. I've been a Dharma student for decades. Teaching here in Florida. Lots of hospice experience. Seems like a logical next step. Okay, wonderful. Well, thank you all. Lovely to meet you all. So, we are scheduled, Jennifer and I at least will be here until noon today. And we will be taking you through 2 sessions. So we'll have a break in the middle, like a 15-minute break. And our break will be at 10:30 Pacific time. Okay, so coming up before the break, we're going to talk about what is chaplaincy. What is a chaplain? What is spiritual pastoral care, which is another name for chaplaincy. And so Jennifer is going to present that, and she's going to talk a little bit also about the history of chaplaincy in the United States. Okay. And then following that, I'm going to talk a little bit about what it looks like to be a chaplain, to work as a chaplain, um, a day in the life of a chaplain. I'll mostly be speaking from my own experience working and training in a hospital setting, and talking about steps to becoming a chaplain. And then we'll have some time for questions before the break. Okay, so that'll be the first half of the morning. And then the second half of the morning, we're going to zoom in more on Buddhist chaplaincy, specifically Buddhist chaplaincy. So, what is Buddhist chaplaincy? Okay. And then we'll move into an overview of the programs that we offer at the Sati Center. So, we currently offer two chaplaincy training programs that we call an introduction to chaplaincy. And one of them is online. So it's for folks who cannot commute to the Bay Area in California, and an in-person training for folks who can. Okay, so we're going to talk about those two programs. And then we'll have our guest speaker, who's a former participant of this program, Ram Appalaraju. He will come and talk about his experience taking the program and talk a little bit about what he's done since he did do the program, like what kind of opportunities opened up for him after that. And then we'll have time for a few more questions and or discussion before we close out at noon. Okay. So I will paste this little schedule into the chat so that you can refer to it if that's useful. And I will now hand it over to Jennifer to say hi.
Am I cut off on the head by about this?
No.
Okay, on my screen I am, and I keep fiddling with it, but I don't need to. Cool.
Now we can see your head and about half a foot more.
Okay, you can see my hat. Yeah.
You can definitely see your hat. It's lovely.
Cool. Thank you. So welcome, everybody. My name is Jennifer Block. I am happy to say that the Buddhist chaplaincy program at the Sati Center is in its 21st year, and I've been with it since we started. So that's pretty cool. And then with Vanessa last year, she and I launched the online training, so which is an exact duplicate of the in-person training. So that's a little bit about me. And I'm from New Jersey, so I can be kind of strident in my opinions to let you know a little bit where I'm coming from. And people think we're having an argument, but based on where I come from, I think we're having a discussion. So I don't even always realize how I'm coming across. Yeah. So bear with me and please give me a little ounce of patience. Yeah, exactly. So that's a little bit about me. A chaplain, I'm going to dive into what is a chaplain and what is spiritual care. So the word chaplain, one version is that originates from the French word chapelle, which means cloak. And there's a story about a man who saw mud as somebody was approaching it. So he threw his cape into the mud, his cloak into the mud to keep the person from getting their clothing dirty. It's also originates from the word chapel. And so chapels were in large fiefdoms or areas of Europe where the royals were not able to often be with the public. And the royals were also the head of the church, particularly in England and France. The word chapel comes from chaplain, and a chaplain in a chapel, the purpose was to have a little more contact and connection between the royals and the people. And so priests and clergy were posted in chapels in different regions. And so the word also comes from chaplain. And the reason that chaplains today are often used is the chaplains are ministers who provide care to people in distress, particularly when those people in distress cannot get home. And so this is one of the reasons that the US military has chaplains, is that people are displaced from the places of refuge, we could say. Yeah. And so the chaplain becomes and represents the faith tradition to the people that are in the military. Yeah. And probably the first chaplain I ever was aware of as a girl was watching MASH. Does anybody remember Father Mulcahy? You know, who was a good old Irish Catholic priest. Yeah, that's a television show from the 70s. If I'm carbon dating myself. Yeah. So this is a very important distinction: is that chaplains provide spiritual care and support to people who are in a crisis, and those people cannot get home. So fast forward from Father Mulcahy to now, the first institution in this country to employ and deploy chaplains was the military. Yeah, and there were chaplains as far back as the Civil War. Yeah. Fast forward to modern day, people are displaced when they're incarcerated, when they're in an educational setting, when they're driving trucks for hundreds or thousands of miles, and when people are hospitalized or in a long-term care facility. Yeah. So those are the primary institutions. And yes, you did hear me correctly. I said trucking. Yes. Um, there's a high occurrence of alcoholism and drug addiction in truck drivers. And so the shipping companies now provide spiritual care to the truckers in, of all places, rest stops and diners and rest stops. Yeah. Uh, so people who cannot get back to their usual sources of refuge because of the nature of the way they're living their lives, their employment or deployment, um, or when people are, driving down the road one day and get into a car accident. They didn't leave the house thinking, I'm going to have a car accident today. So it's unexpected. They're brought to the hospital. Maybe they'd stay overnight, and the chaplain is just going to go see them in the healthcare institution. Yeah. A lot of hospitals have the goal of providing or offering spiritual support to people within 24 hours of admission. You know, the military chaplains are organized by faith tradition, and most people in the military are Christian, but that demographic is quickly changing in this country. And there are now chaplains that are not just Christian, but Buddhist as well as Muslim, as well. And historically, there have been Jewish chaplains. Yeah. So Buddhist chaplaincy has just within the last 10 years joined military chaplaincy. Yeah. And in terms of what chaplains do, is they provide spiritual care to people when they're in a crisis. And when people are in a crisis, they're people don't have their wits about them. They're stressed, they're disoriented. Um, their loved ones may come for their crisis, like if you went to the ER, to the hospital, and then the family, who are all in shock, are adding to the chaos or disorientation. Yeah. And so there are studies now of the efficacy of spiritual care for in healthcare settings. That people have shorter stays, and there's better communication amongst the staff, and people report higher satisfaction when they're surveyed about their hospital stay. There are also chaplains in long-term care health facilities, such as assisted living um, or memory care and hospice care. Yeah. So that's a little bit about the word itself, and uh, I'm going to click on the chat box now just to check to see if anybody's logged any questions, so I can at least be current. Okay, cool, great. In terms of what chaplains do, chaplains, some ways, chaplains in some facilities can function as a host or a hostess, or a concierge, like welcome. So there's a hospitality function. Welcome. Uh, Here's a service that we offer. In most places in healthcare, it's an optional service. It's not required. So the chaplain is in the unique position of being the only person in healthcare that patients can decline the service. So, like, you can't decline having blood drawn. Um, did I mention prisons? Uh, Prisons, yes. Thank you. I did not mention prisons. So people who are incarcerated are in crisis, long term, and unable to um, perhaps attend a religious service on a regular basis, or have a relationship with a clergy person when they're in crisis. Thank you. Was that David I saw, or Steve in New Jersey? Yeah, thank you for that. So hospitality, the chaplain is the one person who you can literally kick out of the room and say, "Don't come back." So that for can be very useful for people, because you can't kick out the nurse or the doctor or the person who draws blood, you know, um, or the psychologist or the social worker. Yeah. So, um, and one of the things we cover in our training is how to introduce yourself in your role, providing spiritual care, how to articulate that in, like, how long it would take to ride up in an elevator with some people, you know, and help the institution express the the view that the patient is a whole person, and so whole person care includes spiritual care, or care in regards to how people make sense of what's happened, uh, how people can heal in the middle of their crisis, particularly for incarceration, um, as well as have somebody that they can have some um, real good company, you know, company that doesn't want to drill you with questions and then turn on the television, but somebody that can really be present and offer empathy. Um, and maybe I'll ask Vanessa if you could put up the first slide. It's funny how we call them slides. The first visual of the structure of a care relationship. This is just going to give you a visual aid for what I'm talking about. Great. So we have one box uh, in the very center. The title of this is Structure of a Care Relationship. So there's a box that says us, and there's me, and there's you, and then there's the context. So in chaplaincy, a primary focus is about establishing a care relationship between myself and you, and so that we can create an us. and have a shared experience. And then outside the box in gray there, it says context. So regardless of context, ideally the chaplain is seeking and has skill in creating a caring relationship. And the components of the relationship are me and you and us. And this is kind of a novel, unique, is that for other providers in a particular setting, whether it's a guard, an administrator, a doctor, they're not always interested in us, but actually the us is kind of the container, if you will, or the goal is to create an us, you know. And even if somebody says no, thank you, I might say, well, I'm happy to know that you know your mind, and you may change your mind. And so I may pop back in a few days if I see that you're more here than more than a couple nights. Yeah, yeah. So, and then chaplains, in terms of what they do, um, is uh, mostly or a lot of listening and expressing empathy or care. Yeah. So, what that can look like is um, asking uh, what what brought you here today, you know, and what's happening for you today, or what's on your mind and heart. I'm happy to listen to you make sense of it by telling me a little bit about yourself. And then I will respond in kind to help orient you. And I'm assuming that you're in some level of shock or trauma. And so I want to offer companionship for you in that experience. Yeah. Hopefully towards your healing and coming into alignment with your body, mind, and spirit. Yeah, exactly. I'm often asked, are you uh, a minister? Are you ordained? Are you Catholic? Are you Jewish? You know, like people want to know a little bit about my faith identity. And the general rule of thumb is not to, as a chaplain, to not say more than 3 sentences about yourself. So I might say, I'm a Buddhist chaplain, and I'm a mystical Christian, and I'm from New Jersey, so I'm a little direct. And it's my sincere wish to see you through this experience with as little long-term trauma, um, while we're helping care for your body, and that I can be a companion or a refuge to you, as will my other chaplain colleagues, as you go through this experience, so that we create ideal conditions for your whole being to be healed. Yeah. That's a little longer than an elevator ride, depending on what floor you're going to. But there's a few things I say. I say Buddhist, and I say Christian, and I say, so then I declare that I have more than one faith identity, which is a common thing for people in the state of California in this country. Um, California has the most pluralistic demographic religiously, according to a study by the Pew Center for Research for Religion in America. Pluralistic meaning people who have more than one faith identity. You know, like I was raised a Catholic, but I go to the Quaker church down the street, for example, or Quaker meeting. Yeah. Uh, and chaplains also in healthcare, which is a lot of my examples today will be from healthcare because I've worked primarily in healthcare. Um, Chaplains also support the staff. So if the staff have a patient who's very disruptive or verbally um, sharp in their language or throw their food tray across the room, you know. So I support the staff in coping with what it's like to care for people who are in a crisis or in an altered state of some sort or another, or if there's an unexpected death, or if there's something that's gone on, like the death might be in their personal life, it might have happened overnight, and I've learned first thing in the morning, like there was a death at 2 a.m. and the staff are just now leaving at 8. So why don't you go see the staff first thing this morning and let them know that you're available to them to provide spiritual care and support. And then lastly, it's worth mentioning, chaplains also make a spiritual assessment. So I have an idea of like, what does this person, what the question is, what does this person need? Do they need uh, time and space, uninterrupted time? Or do they need to have their clergy person called and invited to come in to be with them? Or do they need uh, to know when the next 12-step meeting is within, on a Zoom call in the next 24 hours? Because that's a part of their daily spiritual practice is attending 12-step meetings. Two, does this person need a rosary? Does this person need a hot cup of coffee? And then, or does this person need to know that the nurses know that they are waiting? This is a big one in healthcare. Like, does the nurse know I'm waiting? Or I've I've used the call button and it seems like it takes 10 minutes. Yeah. So that's a lot of what I do. I don't uh, touch people often. I might once in a while put my hand on somebody's shoulder, but the work of chaplains is ideally not touch related or centric. And um, this is often uh, for reasons of misunderstanding and preventing misunderstanding, as well as in support of clergy not confusing people with touch, given all the trauma in all the ways that uh, religion and sexuality get tangled. And the two of them have been tangling or tangoing for a couple thousand years. And so trying to unravel that. So if you're somebody that likes to touch people a lot, the guideline I give is a hand on the shoulder, or you can hold hands while you pray with somebody, but we're not like kind of like, oh, you poor thing, like there's none of that for a number of reasons. And then lastly, I already said that chaplains communicate to the staff what's happening for the patient. So if somebody says, is this a confidential conversation? My answer is no. I will be communicating the essence of our conversation and what I think your spiritual needs are to the team to enable all of us to care for you in the best way possible. If there's something super confidential that you want to tell me, um, double check with me. I may have to tell you I can't keep that confidential. Yeah. Like, for example, if somebody has a bottle of alcohol with them in their room that somebody brought them, and I observe it, I'm like, I need to let the staff know there's a bottle of alcohol in the room because if you ingest it, it's going to contribute and maybe even unproductively interact with the other ways that we're caring for you. Yeah. So there's a little bit of establishing some boundaries, letting them know like who's in charge. Like the main being that's in charge is their body, and then the second is the staff. Yeah. And that I'm not in charge and that I'm working for the institution. Yeah, exactly. I will check the chat again. Feel free to lob in a question. Oh, I clicked leave meeting. Cancel, 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 cancel. Chat. 2. Yay. Unhoused and marginalized another group of the displaced, and did you mention prisons? Yeah. So one of the faculty of our online course uh, works for an organization that takes care of um, displaced people or unhoused people or marginalized people. Um, and I'll get to the next question in a second. And so, because people who are um, unhoused or in maybe they're coming through where you are on their way to somewhere else. Yeah, exactly. Um, is mentioning Buddhism an obstacle? Well, it's it's usually a surprise first for people like, what? I thought all you chaplains were Catholic, like Father Mulcahy from MASH, you know. And I say, well, I'm sure Father Mulcahy and I had a similar heart, you know, yeah, or shared heart. But his background and upbringing um, was just probably very different than mine. You know, I had no religious upbringing aside from the Girl Scouts and the Girl Scout promise and the Girl Scout vow. Um, but I was introduced to mindfulness, which is often taught and offered in healthcare settings, and it's what works for me. Um, if somebody's expecting, if somebody is Roman Catholic, and I first trained in a Catholic hospital, and so they thought everybody who came in the room that was a chaplain was Catholic. And so it was shocking, if not distressing for them that I was not a Catholic. You know, that's its own thing. And the skill is how to kind of like establish your credibility, your availability, and that actually it doesn't matter what my faith tradition is. You know, it's more important to me that I understand who you are than you understand who I am. But yes, there are Buddhist chaplains. We're few and far between, but growing in number, given the registration for this workshop today. And then also, it's not an obstacle, and that some people have already assumed what we'll be talking about. And so it can be disarming for me to say I'm a Buddhist chaplain. Yeah, you know. But like I said, I'm the one person who get kicked out of the room when they say, well, I want to see a Catholic priest. This is what I need. I need you to call my priest. And to which I say, thank you. What's the name of the parish? And the person that I have your permission, let them know you're in the hospital. And I will call the priest. First, I'll call the parish, then I'll ask if I can call the priest. And uh, just as a realistic expectation, once upon a time, Catholic priests had to drop everything and come to see people in the hospital, and they were there within 24 hours. Um, Catholic priests these days have different boundaries than once upon a time. And so they have days off and days on. So if the priest day is off today, then I can leave a message and call back tomorrow. And I also encourage you to contact your priest because I'm a stranger to your priest, but you are a member of their parish and they may have a different understanding of their days off and on. Might be different because I'm different. Yeah. Let me go back to our outline to see what I was supposed to talk about. I feel like I've been saying a lot. I know I've said a lot in the last 20 minutes, but you're going to hear a lot today. So, and our intention is to give you a lot to think about and help you in your own um, discernment um, about, what is this? And am I interested enough to take an educational course? Um, And hopefully today will help you understand what this is not or does not include. Um, and you might already think I'm a body worker, I'm in the wrong place. if there's not a lot of touch involved in spiritual care. Now, mind you, if you are a body worker, a lot of body workers do think that what they're doing is spiritual, but body workers have a different context than spiritual care. Yeah. History. Okay. Then I'm going to pass it over to Vanessa. So I talked historically that there's been chaplains in the military for hundreds of years. Also, in this country, in the 1940s and 50s, some clergy were hospitalized and discovered. I'll get back to your question in a minute, Barbara. And discovered that when they were hospitalized, what they needed was spiritual care as compared to psychiatric care. And they also realized that in the other people on their unit that they were able to care for other people in the hospital. So the modern day spiritual care movement is about 70 years old, traces its roots back to Christian ministers who were actually in a healthcare crisis. Yeah. And then the field of spiritual care, or it's also called pastoral care, has been developed, and there's lots of books about it. There's one or two books about Buddhist spiritual care that we can let you know later. Yeah. And Barbara had a question about related to Catholicism. So can you hold your question, Karen, till a little bit later for about an hour? Okay, great, great. And I trained with a lot of Catholic chaplains, so hopefully I can answer your question when we get there. Yeah. And then another question says, what distinguishes a Buddhist chaplain from another spiritual tradition? Chaplaincy did not arise from a Buddhist tradition. Well, here's the story. When I trained as a chaplain, which was 1998, I didn't know any Buddhist chaplains, and all the chaplains were Christian. And I was a bit of an ugly duckling, waddling my way through, and tenacious enough and brave enough to kind of go it alone. And then about 4 years later, I heard there was another Buddhist chaplain who I tracked down at a conference, and tapped on the shoulder and said, "Are you a Buddhist chaplain?" And he said, "Yes." And I said, "Well, then I'm another one." Yeah. And then in 2003, the Sati Center for Buddhist Studies had decided to host a day-long about chaplaincy like we're hosting today. And at the end of the day, the leader, Gil Fronsdale, who's also on our faculty, asked people, and a lot of people came up, like 100 people showed up. And he asked, how many of you would be interested in a Buddhist chaplaincy training? And all the hands in the room went up. And this is at the end of the day. And then he said, okay, now how many of you would actually apply, enroll, and register and pay for a Buddhist chaplaincy? And almost all the number of hands went up. And so at that juncture, Gil Fronsdale said, oh, I think this might be something that we might want to do. So that's the history of this particular training. There are other Buddhist chaplaincy trainings. You can Google Buddhist chaplaincy training in New York and Colorado and New Mexico, and some in Europe that Vanessa can slip in later. But we have been doing that. We're now in our 21st year. And I'm very proud of that. It makes me really smile. Yeah. It's been a very joyful experience and deeply rewarding. I was teaching yesterday our April class, and we were doing something called case presentations, where the students were bringing into the room a situation that bothered them or that has kind of stuck in their brain, or that they regretted not knowing something about it. So we asked the students to present that situation, describe it briefly, and then allow us to ask questions, um, to help them think about it through more. And so by April, and we are now, 7 months into the program, people are popping, like they're like, "Oh, I want to talk about this person who's not talking about their dying and they're in hospice," or I want to talk about what I what to do when a staff person interrupts me and kicks me out of the room. Because I'm the staff cannot kick me out of the room, and how can I make that clear to them? Yeah. Do I do it in the moment? Do I pull them aside later? What's a tactful way? To say to a doctor in a white coat, um, "Can you come back later? Yeah, I won't be long." Yeah. So everybody in the class had a case presentation in mind, and it was very thrilling. Like at this juncture in the year, people are like not asking questions like, "How do I introduce myself?" or "How do I center myself once I've driven in traffic for 45 minutes?" Or "How do I answer, the question, what's a chaplain?" Yeah. The people are at a non-introductory level, like, "What do I say when this happens?" or "How can I find this information?" or uh, why would somebody, um, when I knock on the door, say, "Come in," and they're naked, like they're not wearing any clothing. How do I handle that? It's more of a later in the year question. Yeah, exactly. To which, you can to answer the question, you can be like, "Oh, I didn't expect you to be undressed. Shall I step out while you get dressed and come back in a minute?" So you're kind of setting a boundary that you don't wanna talk to them without their clothes on, and you're dropping a pretty big hint, like, "It'd really be great for me in what I'm here for if you could put your clothes back on." Now, why would somebody say, "Come in"? They don't realize they're naked, or, um they live a lot of their life being naked, or um, they think that they need to be naked for whoever's knocking at the door. And maybe the last person who came into the room said, I need you to take your gown off so I can treat something, some part of you. Yeah. Why else might people not be dressed? Well, if you can shock and surprise somebody, it establishes a degree of control and autonomy, and you can make a choice about taking your clothes off or not. So for a lot of people, um, and it can throw whoever's coming through the door off, and so you can kind of have a little bit more ground and throw them off. Also, sexuality is a powerful aspects of our individual lives and in society, and so it's a way to feel powerful, to kind of be naked, or bring up the topic of um, sexual activity or sexual identity, um, early on in a conversation, which to me might seem early, but I'll think about, they really want to feel powerful right now. I'm sure they feel really disempowered, being in a gown, being told when to eat, and not being able to use the toilet on their own. So why wouldn't they bring sex into the room as a way to feel powerful? To which I've often said to somebody, well, by inviting sex into our conversation through your initiation, it tells me that you might be feeling a little bit vulnerable. And so bringing sex into a conversation is a way to, because sex is so powerful in itself, it's this life force. So maybe that just tells me something about you in itself. you know. So I'm not ignoring the comment. I'm not saying, I'm not shaming them or making them wrong. Um, I'm just noting it and saying like, "Okay, there's an elephant in the room, and I like to name the elephants." Yeah, exactly. Now, that is not a 5-pound weight when you're learning to be a chaplain. That's a 50-pound weight. So if you're panicking, thinking, "I can't take this training, I don't wanna talk about sex," You don't have to talk about sex. That's a 50-pound weight that we talk about in May in this training, or June at the very end, like when you're ready for it. Yeah. And when you've already probably bumped into a few situations where there's something in the room that's part of your attending to people and caring for people. Yeah. Or that somebody has come out to you, but not come out to the staff, if something happens. Yeah. Okay. So, what is chaplaincy? A little bit of the history, a few examples. Again, all my examples are from healthcare. And I'm going to transition and pass it over to Vanessa when I once again open my laptop to look at the schedule.
Thank you,
Vanessa,
Jennifer.
sure.
So thank you so much. So that's a kind of general introduction to chaplaincy. And like we said, today you're going to be hearing a lot more examples from healthcare because it's just where Jennifer and I have our work experience. Having said that, there are, faculty members that have, as Jennifer mentioned, experience with other settings as well. And Ram, who'll be joining us later, it works in the prison setting. So, and in eco-chaplaincy, which is another arm of chaplaincy, a rapidly growing new sort of area of chaplaincy that's also very interesting. And there's a program that the Sati Center offers as well, a training in eco-chaplaincy that there's information on the website. So I'm going to talk a little bit more about what a day in the life of a chaplain looks like. And if I had to give my elevator pitch about what it is that a chaplain does, or what really draws me to this work, I would say that what a chaplain does is they advocate for a person's spiritual integrity in an institutional setting. We advocate for people's spiritual integrity. And so that can show up in all manner of different ways, and what spirituality, means from one person to the next can be vastly different. It can be about so many different elements of, meaning making, relationships, connection or disconnection from loved ones, relationship to spiritual practice, to religious community, the way in which we make sense of things. Does my life make sense? All these kinds of questions, and what supports me in times of crisis, what strengthens me, what helps bring me forward. So these are all the kind of supportive spirituality areas that a chaplain can be there for and look out for. I wanted to talk about like two levels of chaplaincy work, because I think that a lot of people come and take this program, they're already doing some kind of volunteer work. Okay, so that we meet lots of folks who come into this program. Maybe some people among you, I think, already mentioned in the chat, you've been doing volunteer work, maybe working in prisons, working in hospice, working as a volunteer in a hospital. And a lot of people take our program to then just continue doing the volunteer work. It's something that can be very, very satisfying and a wonderful extension of Dharma practice, sort of a service aspect of Dharma practice. So as a volunteer, like I mentioned, you could be working in any one of those arenas, or more that we've mentioned, also eco-chaplaincy, or working with unhoused people. And in that capacity as a volunteer, you're providing company, you're accompanying people, you're providing what we sometimes call, another phrase for it is ministry of presence, a ministry of presence to people, whether they are patients, whether they are inmates, whether they are a displaced person, whether they are the family of a loved one who is in any one of these situations. So providing spiritual support however that looks, providing emotional support, just being someone who can be there, who can listen to a person talk. Even just that can be so incredibly powerful and healing. There's a program, some hospitals have this program called No One Dies Alone, that a lot of people, maybe you've heard of it, a lot of people volunteer for this program. And often this program supports people who are in the active stages of dying and who do not have family or friends to be with them. And so volunteers come and just sit with somebody, in these final moments of their life. And very often people in these moments are not even aware or conscious. So as a volunteer, you might just be sitting with somebody who's non-responsive, non-communicative, but just providing that presence, just accompanying somebody, breathing with somebody in those final moments. A chaplain, even a volunteer chaplain, and I'm still talking about volunteer chaplains, can, for example, support difficult conversations, So if when somebody has received a poor prognosis or diagnosis, something shocking has happened, the chaplain can be somebody who can bring that out into the light, help support having that difficult conversation. A volunteer chaplain is at the service of somebody according to whatever needs they might have in that moment that would be of some kind of religious or spiritual nature. So you might facilitate prayer if you're, volunteering at a hospital and you're there as a spiritual care volunteer. Somebody might say to you, before you leave, could we pray together? Or some kind of ritual. You could provide some kind of ritual. Or since you're Buddhists and you have experience with meditation practice, perhaps you have the ability to offer guided meditation to people in the right circumstances, of course. So there's a kind of a service, what can I do for you? What can I facilitate for you? What do you need in this moment? Perhaps a person just needs to be connected with their own spiritual community. Perhaps they just need to see a Catholic priest because they need a specific rite to be performed, something that you're not able to do or not authorized to do. So how can you help to bring that around? And then a lot of volunteers also work in the area of facilitating group events as well. I know that, so I'm a former participant of this program. I took it back in 2019. And part of my service work at the time was working in a jail in San Francisco, facilitating a spirituality group. So that spirituality group, we'd go in once a week and offer guided meditation and some spiritual discussion and kind of general listening to some of the inmates who wanted to join the group. So all of these volunteer activities are also things that a professional chaplain would do. Okay, these are kind of just very basic, day-to-day activities of a volunteer chaplain that also exist in professional chaplaincy. On a professional level, I'll tell you a little bit just about my experience in healthcare, being in a hospital. Often a chaplain working in a hospital will have a specialization area. So you might be an oncology chaplain or working in palliative care or maybe in the psychiatric units. Yeah. And so when you come in of an average day, you'll probably be met with a list of referrals. So that, the other staff who are working in those contexts will have referred a number of patients to you who they think will do well, to receive at least a visit, an offer of a visit from a spiritual caregiver. Or perhaps the patients or their families have requested themselves to see a chaplain. Okay, so these are all referrals. These are people kind of asking you to come. And then if you have your specific unit that you're working in, then you might also round on those units, just like a doctor would. So you can pop your head in the door and introduce yourself and offer for the person, would you like some time? Would you like a spiritual care visit, or should I come back later, or would you just not like that at all? We give choices all the time. It's good to give choices, now or later. We don't want anybody to feel pressured into this service. And then during the course of those rounds, we're also checking in with staff, having really quite tight relationships with the multidisciplinary staff who work there. So with the nurses, with the social workers, with psychologists, with doctors, nutritionists even, It's wonderful to have relationships and ongoing conversations with all of these people. And I would often attend the multidisciplinary meetings in the morning. A unit would always have a short multidisciplinary meeting, a rounds, and we would come together and as a group, as a multidisciplinary group, try and figure out who needs what that day and where those chaplaincy services can go. Because you're a limited resource, unfortunately, you can't see everybody. So discerning where the need is. And then the types of calls, there could be, someone might be in distress and they would call the chaplains. Often chaplains are called when somebody's close to death, or they're absolutely called when somebody has died. So that's always a for sure, a for sure call. Once somebody has passed away somewhere on a unit, a chaplain will be called to attend to the situation, to attend to that person's family. Often the chaplain is the person who fills in all the paperwork after somebody has died. Helping people fill out advanced care directives, providing people with prayer materials. Perhaps a Muslim patient got rushed into hospital and they don't have their prayer mat with them, or they would like some beads, or somebody would like a Bible. So being able to provide those materials for people. Talking to disgruntled family members, when they're very frustrated about something that's happening in the hospital, so being called in to care for those kinds of situations. And then the other part of it is, with working within that multidisciplinary team, we also do a lot of, you contribute to the charting, just like any other care member would in the hospital. When a patient has their chart, if they're visited by a chaplain, your notes go in there along with everybody else's, because this is really part of the idea of the holistic care. And so, whatever happens in the chaplaincy visit, there's a very good chance, one hopes, that the doctor will read those notes and that the social worker will read those notes, and that, that will be able to then further inform this person's care going forward. Often if you're working in a hospital, you might be called to be on call. You might be on call of a day, and that sort of means that, or of a night, which means that you're covering the whole hospital when everybody else is away or asleep. And so during that time, you might be called to the ER in emergencies, to any code blues that happen anywhere in the hospital. I personally worked at Stanford Hospital, which is connected to Lucille Packard, which is the children's hospital next door. They have their own set of chaplains, but at nighttime and on weekends, they use the on-call chaplains, when their resident chaplains are not there. So being called to emergencies in the children's hospital, performing emergency baptisms, very, very sad if a child has a poor prognosis or is about to pass away. It's the chaplain who would come in, and if the parents wanted to perform an emergency baptism or a baptism for the child. So there's some heartbreaking work as well. Yeah. So steps to becoming a chaplain. I haven't looked at if anybody's got any questions, but I'd say that I would love to, maybe it might just be easier to take questions later. Let me just take a quick look. Is there a similar model for charting that multidisciplinary teams in the jail prison settings? I do not know. That would be something that Ram would be able to tell us about. But yeah, I don't know how it works in the incarceration settings. Okay, so how do I become a chaplain? I'm in. Like, I want to do this. How do I do this? Um, I just to give you a little background, I'm a Zen practitioner. I'm ordained as a priest in the Zen tradition, and I've been practicing for many years. And I was living in California, attending my local Zen center in Mountain View. And then one day I passed on the notice board. There was a flyer for this exact event, but many years past, this event, Introduction to Buddhist Chaplaincy. And I just saw these two words, Buddhist Chaplaincy. And like, I had never seen those two words together before. Like, I didn't realize that this was an option. I didn't realize that this was a thing. And it suddenly became very, very clear to me that something that I had wanted for many years, which was to be able to take my practice out of the zendo, out of the place of practice, off my cushion and into the world. And I'd never quite found a clear way how to do this. And suddenly it seemed like there was an opportunity, to really kind of, to follow a path, to train into something very concrete. And I have to say, I've never looked back. So, first steps already. I mean, I think if you're here, by definition, you have some kind of practice. Perhaps you're practicing with a community. Perhaps you have a teacher. Perhaps you practice at home on your own. Perhaps your practice involves going on retreats. And, perhaps you have some kind of leadership position within your community. So all of these things like that world is already alive for you. And then maybe you're already doing volunteer work, or maybe that's something that you want to do. But volunteer, starting as a volunteer to get that sense of really what this is about, you don't, it can be quite easy to idealize volunteer work on the one hand, or be extremely freaked out by it on the other hand. How could I possibly work in a hospice with people dying around me every day? How could I go into a prison and witness that amount of suffering and then just continue with my life? How will I perform under these circumstances? So trying volunteer work. And if you don't know what kind of volunteer work you feel that you want to do, I encourage you to try different kinds of, different areas. And then the foundational training, like I posted before in the chat, a few other places that also offer, but like a foundational Buddhist chaplaincy training. So our training, and I think a lot of the trainings of the places I posted, they're not a full professional certification in themselves. They're a foundational training. They're kind of meant to sort of prepare the ground, to prepare you for then what comes next, if you want to take the option of going into more, professional formation. So ours is a foundational training. Okay, so these are the first steps: a foundational training, volunteer work, and having a well-oiled practice that's in full swing. I think these are kind of three great first steps to have if this is the direction that you want to go in. And then the next step for somebody who wants to really work towards a professional career, or professional few years with chaplaincy, would be to do something called CPE. That's clinical pastoral education. And here's what I'm going to do. I'm not going to, we could spend 2 hours talking about CPE right now, but what I'm going to do is I'm going to put a link in the chat to a wonderful, wonderful organization and website called the Chaplaincy Innovation Lab. There's the link. So the Chaplaincy Innovation Lab is an interfaith chaplaincy organization. They have all sorts of events. They support all sorts of projects. They do really exciting stuff. And the particular link that I've sent you here, that they provide a little booklet that's like a beginner's guide to CPE, okay, which is the foundational, no, not the foundation, sorry, the professional chaplaincy training, okay, and it's what is required if you eventually want to go on to do full certification as a chaplain. And that process does take a long time. So this CPE training in itself, if you do it intensely as a resident in a hospital, and hospitals is where it is mostly taught. There are some other options, and it's beginning to kind of diversify a little bit. But for the most part, CPE is taught in hospitals. And you have two options. You can go in as a resident, which means you are there as a full-time person in the hospital. It's a very, and that takes 1 year. And it's very, very intense and wonderful. And the other option is you do it kind of half-time. So you can do it kind of in modules, and if you did it all at once, it would take 2 years, or you can space yourself out and it could take several years. So that's CPE. And from going back to your spiritual community or practice, there is a requirement of ordination or equivalent of ordination. As you start to kind of go, deeper into professional chaplaincy, there is a requirement for an endorsement from your spiritual community. And given the often unusual ways, I think, especially now, that many people engage their spiritual practice, that isn't always so straightforward. And that's not something that I can really answer for you today, but that's something that for most of you would be much, much further down the line anyway. A fully certified professional chaplain would also need a Master's of Divinity. A Master's of Divinity, and there's lots of places that one can do that. If you're living in California, near the Bay Area, there's the Institute of Buddhist Studies in Berkeley, is one place that a lot of people go as Buddhists to get a Master's of Divinity. So again, this is not something I'm going to give too much. I can't give any more information than that today, but just so that you kind of have an idea of what's further down the line. And then there's a process of, also one has to work after the initial training, after that CPE 1 year, 2 year training, you need to then work for another 2,000 hours, which would be about 2 or 3 years working as a chaplain or as a volunteer chaplain. And then going through a process of personal competence, which just means writing a lot of essays. I think there's about 30 that are required to get to that final point of certification. So when you meet chaplains who have completed that entire process, they're all sort of a little bit pale and tired looking because they've really been through the ringer. Like it's really, and they're glowing because they've finally achieved this thing that they've been working so hard to do for many years. But it's a good point to make that you do not need to be a fully certified chaplain. Having those 4 units of CPE is enough to get paid work as a chaplain, especially with more private organizations and especially hospice. So bearing that in mind, it is not necessary to get the full certification if you want to be compensated as a chaplain. Like you really, the most important thing would be to do the CPE and to complete the CPE. Whew. Okay, so that's everything I wanted to say. I feel like that's just a dump truck of information. That's really a lot of information to take on. We've got a lot of information on our website, on the sati.org little chaplaincy section. So do go back and refer to that as well. And after this call today, we're going to send you a little like PDF document that summarizes a lot of the things that we've talked about today as well. Okay, so it's like a little reader, and you'll receive that by email. And it'll also be available to download from our website eventually when we post these recordings too. So anyone who's listening to this who's not present right now on the Zoom call, you'll be able to download this document too. So I'm going to take a look at the chat and see where we are. Great. Yeah, thank you, Stephanie. If you go full-time in CPE, you receive a stipend. You will receive a stipend. If you're doing it part-time, you don't. And in both cases, you pay a small fee for the tuition. But it's relatively, I can't remember now off the top of my head. I think it was a few $100s for each unit, like a few $100s for each unit. And then the stipend itself just depends on the hospital and where it is. So some hospitals pay more, some hospitals pay less. It's usually relative to where you're living, probably modest-ish, but it doesn't usually cover like healthcare and things like that. But it's still better than having to pay for it yourself, as an option. And you do get a modest stipend, maybe, I don't know off the top of my head, $4,000 or $5,000 a month. Which, when I say that coming from France, that's really a lot of money here in France. But in California, it doesn't go so far. Did I get that right? Yeah, something like that. Yeah. So just to give you a ballpark idea, that was California stipend. I don't know how it is in other states. So Lauren, in answer to your question, David, I think, did I answer your question, David, about what would be involved on the path of qualification? I'm going to assume I did. And then if you have any more questions, you can come forward. Yes, I did. Thank you, David. Okay. So Lauren, yes, chaplaincy is entering the corporate world. I can't tell you a whole lot more about that. I think it's a Google away, but I've heard of people working in companies. Yeah, the short answer is yes, and I think that's also an emerging field. Okay, so we have 15 minutes until the break. So if you'd actually like to ask a voice question, or perhaps you have a comment, or something, let it perhaps come forward if you'd like to ask something or some clarification. So Liesel, did I say your name right?
Yeah.
Liesel?
I was just curious about, said some of the first steps are starting as a volunteer. What kind of options are out there if you don't have any training yet, to be getting into those volunteer positions, and just suggestions there?
That's a great question. I've been amazed to learn, how many institutions there are that do welcome and really make good use of volunteers going in. So just taking a hospital as an example, or a prison, these are two, or hospice, like these are very frequent places that take volunteers. And usually, like in the case of a hospital, you might go on their website and navigate to the spiritual care department page if they have one. And there might be a little volunteers section within that where you'd find information about how to apply, or just generally on the hospital website, there might be information. And then again, wherever you are locally, looking at the various like websites of the incarceration institutions, prisons, jails, there might also be something similar. So what they might do is, call you in. There'll probably be an application form. They call you in for an interview, and then there's often background checks. often even things like vaccinations if you're working in a hospital setting. And then you would probably be subject to some kind of training, like a mini training that is appropriate to where you're going. So it might be my own experience with that when I went to work in a hospital is that somebody sat down with me and gave me like 12 sheets of A4 and said, read these, you'll be fine. And that was my training, whereas like other hospitals will actually like call you in for like a full 3-day session. And they go through like a lot of the basic like caregiving skills that we go through. But yeah, so there'll be an element of preparation, especially if you're going to volunteer in a prison or a jail, there's a lot of preparation around that and learning of rules and etiquette and whatnot and legalities. So does that answer your question?
Yes, thank you.
Thank you. So Peter.
Yeah, I think my question is a little similar. I was looking around at different places that I might volunteer, and I was kind of curious what would make, a good opportunity for volunteering as someone who has no training in this, and like, but and kind of imagining like, if it was in a hospital, I was looking at a hospice center and a hospital, and there's a prison nearby, and I didn't call the prison, but it's like what would someone, I mean, I guess it's kind of a question. I mean, maybe it's the same question and there's nothing to say, but it's like, if it was in a hospital, would it be that you would occupy kind of a chaplain role with no training, and they'd like, or like some small mini training, and they'd send you in there and you'd be like, hi, I'm a mini person, and you'd go for it? Or, so I guess it's kind of like, I am curious, like what it would actually, like what they would, they could I could reasonably offer, but also like wanting to know, like wanting to be stretched in, in this train, like in this, would want to be stretched in this program. And so would want to try to be able to understand what would make a good volunteer opportunity. Like, how would I kind of judge that?
Mm-hmm. Yeah, that's a great question. I think, Peter, that the most important thing is the heart that you have going into this in the first place. The fact that you want to do this in the first place, that speaks so much already. And really, I think a lot of places that take volunteers, that is really the main thing they're looking out for. Like, is this a person who I would want to have with me in the room if I was just feeling really rubbish?
Right.
And then everything else comes from there, or everything else builds on that, and the skills that come slowly. It varies from place to place whether you're a volunteer chaplain or just a hospital volunteer, and maybe that's something to look
Right.
out for when you're in your discernment around where you might volunteer. Often, and I think this just from having had experience working at the VA as a federal institution, volunteers there, even if you're working under the spiritual care department, you don't call yourself a volunteer chaplain, you're just a volunteer. And so that changes a little bit your initial relationship with somebody, because when you're just a volunteer, somebody might say, well, I'd love an orange juice, please. And it doesn't get beyond that. Or could you just pass me the remote control? Or, like
Okay.
they're not necessarily from the outset expecting that you will be there in the capacity of a spiritual caregiver.
Yeah, I
So,
appreciate that. Yeah, thank you.
sure. Jennifer, do you have anything to add to that? You'll need your mic on though.
I think at this juncture, in terms of the journey ahead, it takes an average of 3 to 5 years to train at a foundational level, train in a training center such as a hospital or a prison or hospice, or and then to go work for a year, and then the credentialing process can take a year. So it's 3 to 5 years plus your education. So it's 3 to 5 years. Yeah.
Mm.
Yeah.
Yeah,
in terms of, and it's the Masters of Divinity or equivalent. The credentialing body now understands that Buddhist chaplains don't go to seminary. And so there are there's some knowledge in the credentialing body about chaplains, the nature of chaplains' educational and formation process. Yeah, exactly. And here's a funny story. Somebody called me up once and said, actually it was by email, it said, I'm head of a chaplaincy department, and one of my Buddhist chaplains, and we have a dress code that the chaplains wear a jacket, like a business jacket, and no tie, and a button-down shirt. And he said, so the Buddhist chaplain does not want to wear a coat because he thinks and has stated it makes him look like a Christian minister to wear a jacket. And so that in his tradition, it's not allowed to look like a Protestant minister. This is about the most far out thing I've ever heard. So the guy was, he's like, is this true? And I thought to myself, and I just said to him, no, it's not true. There are Buddhist chaplains who do wear unique things and are not as recognizable. But there's nothing I can think of that would keep somebody from not wearing a jacket. Whether it makes them look like a Christian minister or not, that's probably their own assumption and aversion, So that was the one time somebody kind of reached out to me as a Buddhist chaplain just to get it like a reality check, So I said, go back to that person and tell them they need to adhere to the dress code, and they need to come up with a better reason not to. So, and I have found that staff, a lot of them don't know what a chaplain is and need to be trained and learn. And a lot of them don't know when to refer to a chaplain too. So you mentioned staff having a referral list, Vanessa, that some people are like, if they're not dying, I don't refer them to the chaplain. To which what you do as a chaplain is to educate the staff and cultivate a connection with the spiritual care department to say somebody does not need to be dying. If they're angry, if they're sad, if they don't want anybody coming in the room for 12 hours, these are kind of red flags that they may need some spiritual care. So again, there's ongoing kind of orienting people in institutions. And so corporate chaplaincy, there is corporate chaplaincy, and a lot of the job is helping people understand what is spiritual care. I think, and this is probably not true, but I have data to back up my opinion, is that what we now understand today as coaching, I think coaching is straddling psychology and spiritual practice and ethics. Yeah, and kind of coaching is kind of has a foot and a hand and an ear in each of those areas. Yeah. And if you're a coach, you may have been trained to not discuss religion or spirituality, or you may be doing that, and coaching is rewarding work. But I got to tell you, I was part of a coaching company briefly, and they referred to spirituality as woo-woo. Like literally, they would say, like, that's too woo-woo for me, or we're not going to get too woo-woo on you, but we're going to read a poem, and I thought, wow, I'm just too woo-woo, this is not going to work out. Yeah. And I was direct too. Like when people were talking, I would say, so what might that mean to you? Or why is this so important to you? and it was like crickets, like crickets. People were not used to being asked that question, and they got nervous around anything that was, and also was called this terrible phrase I'm using for educational purposes, touchy-feely, all that touchy-feely stuff, yeah. So that's interesting.
Jennifer, I'm just going to cut in. We've only got a couple of minutes till the break, and I want to make sure we get through all the questions, that we hear them all. Okay, I'm going to pass over to Barbara and then Kate.
Oh,
Okay, so so the training there at the Sati Center is a foundational training, you said. So it's
Yes.
before the CPE, correct?
Mhm.
Yep, got it. And then another question is, so I have know a friend who's a Buddhist chaplain, and I think she's a volunteer in a hospital, but she's only called out if their person is a Buddhist.
Mm,
Whereas it sounds like here, or what you're sharing is a little more fluid. So can you speak to that piece? And that may range, I'm in the state, so that may range state to state or even region to region within the state. Anyway,
sure. Yeah, that's a great point, Barbara. It depends. It's not, I don't know if it's so much regional as I think it's just place to place, like hospital to hospital. So and there's definitely hospitals that will place you with people from your same faith background, and that that might be nice, or that might be what you want, or you might say no, I'd prefer to work somewhere where I'm meeting people of all different faiths all the time. Bearing in mind also, in my experience as a hospital chaplain, most of the Buddhists that I met were people of Asian origin from a culture completely different to mine. And when they asked to see a Buddhist priest, I was the last person they expected to see come through the door, you know. And yeah, and other schools or traditions of Buddhism that I was not familiar with. And so for me, in many ways, it was like working with a new religion and learning a lot from that too. So yeah, but we'll talk more about our program after the break as well, and hopefully that'll give you a clearer picture as well.
thank you.
Kate.
I'm willing to wait on my question till later, if that would be helpful, since I know this is when we're supposed to take a break.
Okay, if that's okay with you, thank you. That's very thoughtful, so that we can kind of finish timely. But do keep your question, Kate, and we can come to it later. So let's take a 15-minute break. So we'll be back at 11:45. I'm in France. I don't know. quarter to 8 p.m. here. So I'll see you in 15 minutes. All right, well, welcome back, everybody. I know that was a very quick break. Hope you managed to wolf something down if you were hungry, or whatever you needed to do to refresh yourself a little. So now I'm going to pass back to Jennifer, who is going to say you're going to say a few words about what is Buddhist in italics, chaplaincy.
right.
What's that about?
Well, the Buddhist spiritual care is kind of like a pair of glasses. You might ask, what is Roman Catholic? What is Orthodox Jewish spiritual care, like, depending on the lenses that you're looking for. So first and foremost, Buddhist spiritual care, the eyeglasses have a little like name tag on them that says liberation. And so liberation, as all other things in the Dharma, the potentiality and the point on the horizon that we're heading towards, whether that looks like liberation or awakening or Buddha nature or something else. the Pure Land. So that's a big, and practically speaking, Buddhist chaplaincy involves connection towards yourself and towards another. And the expression of that is compassion or empathy. Now, those are two very different words. So let me give you just a little definition. Empathy is caring about somebody's suffering. Compassion is taking action as a response to somebody's suffering. So there's a lot of use of empathy, and I think people's intention or motivation is to alleviate suffering. But the way that's done is through empathy and compassion. And compassion is more active than empathy. And yeah. Buddhist chaplaincy includes Buddhist ethics regarding restraint from harm. And there's no, in Roman Catholicism, during the 1980s and 90s, there was a big development in Roman Catholic medical ethics. Buddhism has not gotten there yet. To have like okay, this yes and this no. Yeah. The arising of Roman Catholic, what are called religious directives, comes from the questions of the development of medical technology that by the 1960s enabled people to hasten death or conversely prolong life. And so people wanted to know morally, as a Roman Catholic, in this situation, do we hasten or prolong? And it had not come up before then because there wasn't medical technology to go along with that. And so the Roman Catholic Church has specialists, theorists, ethical theorists who have spent decades deciding, discerning, and communicating and reinforcing that part of being a Roman Catholic is to be aware of the Roman Catholic healthcare ethics. And people want to know, like, if I terminate a pregnancy, is that right or wrong, for example? Or if we remove life support, is that right or wrong? And the Roman Catholic Church is in the business of saying things are right or things are wrong, mostly in regards to salvation. Will this inhibit my entry to heaven and ensure my deliverance into hell, or will this do the opposite? Buddhist chaplaincy has a pace about it that's different than many other religious traditions. And so one characteristic of Buddhist spiritual care or chaplaincy is the use of silence and pace. Yeah. Like to ask a question and then hold the fact that there's no answers coming, you know. Or to ask somebody, shall we sit in silence for 5 minutes together and focus on our breathing and practice together? You know? Yeah. So there's a fair amount of silence. And then the pace, I'd say, in Buddhist spiritual care is medium to slow. You know? There are rituals involved in Buddhist spiritual care, such as um, chanting, uh, ceremonies, and Zen practice. I'm affiliated with the San Francisco Zen Center, and in their morning services, they they have a well-being ceremony for people who are in one dimension or another stressed that involves chanting. Yeah. Bowing is a Buddhist ritual. So, you know, somebody might say like, well, I guess I need to bow to that, you know, or, you know. So rituals, other rituals used in Buddhist spiritual care are um, bowing is a big one, use of loving kindness. And then there's language, of course, like Buddhist spiritual care involves, you know, like if I was talking to another Buddhist chaplain, I'd say, you know, on a scale of 1 to 10, how much suffering are they experiencing? Yeah, exactly. And then there's garb or accessories. And so Buddhist chaplaincy looks like somebody who might wear clothing that looks like a martial artist, or they might wear, for the Zen garment of a rakusu, which is like a small Buddha's robe. It's not required unless it's required of from your particular teacher. Um, Buddhist spiritual care also involves a lot of cultivating not knowing. Just like I don't know, I don't know yet, and that makes us able to join people who are like waiting for test results. There's a lot of not knowing in a crisis, particularly in healthcare. So people are like, I don't know. So, you know, we're used to being with difficulty, such as not knowing. So from our practice, we, you might say that we swim in the seas of ambiguity, you know, that we're comfortable with ambiguity and even paradox, yeah. And holding more than one truth at a time. So maybe the family want to withdraw life support, and then the rest of the family want to add more life support. Yeah. They want to continue the person's life as compared to hasten their death. Yeah. And then the chaplain, Buddhist chaplaincy, like it's like, well, not the realm of right and wrong, but what's skillful and unskillful. Now, as a Buddhist chaplain, I usually don't weigh in on people's decisions, but I do clarify the crossroads that people are at. You know, like, I think you need to go left, straight, or right. You know, left is withdrawing life support, right is hastening death, you know, or as people often say, pulling the plug, you know, which is a very crude term that's inaccurate, but it unfortunately has spread like wildfire across our society. Or straight ahead is not knowing, you know, staying the course and deciding to not decide, or deciding to defer to somebody else to make the decision. You know, that's mom's decision, you know, about dad. You know, that's not my place as the cousin, the daughter-in-law, the, you know, whoever. Yeah. And I think also Buddhist chaplaincy includes a perspective that life is suffering, you know, that people might say, why is this happening to me? And a Buddhist might say, because you took birth, or because you took human birth. So you're not dying because of your cancer, you're dying because you were born. That's not something I would say to somebody, because it could come across as dismissive, or what do you say to that? But the confidence to not know, it takes confidence to not know and to not rush knowing. And so we were just talking about this in class yesterday. Like, okay, so I guess you could say that in this training, I really become comfortable with silence and with not knowing and with speaking up. Yeah. There is a book. There's two books. One is called The Arts of Contemplative Care, which I don't have by my side. But there's another new one written called Refuge in the Storm, Buddhist Voices in Crisis Care. So here's a book. And then the other book is called The Arts of Contemplative Care. And then a Buddhist chaplaincy, lastly, I would say, involves identity, and the sense of one's expression of practice. Yeah, exactly. And that can look different, so we have the majority of our students are Theravadan practitioners. Some are Zen. And so the Zen students look at the Theravadan or Vipassana practitioners and think, you guys haven't taken a vow? And then the Theravadan Vipassana people say, not since my last retreat. I took vows like to practice the precepts during the retreat. And the Zen folks say, then why do you practice if you have not taken a vow to save all beings? And so, there's kind of this. And then if it was a Pure Land practitioner, they'd say, well, I practice to get to the Pure Land, which is a whole other thing. Yeah. So we have denominations within the Dharma. Yeah. Mm-hmm. Yesterday, somebody told a story of coming into the parking lot of her apartment building, and a man was in the fetal position to the side of the driveway to the parking lot. And he was not able to converse with her. He was on the ground. And so she called 911 and then proceeded to make sure that people leaving the parking lot saw him and did not hit him. She kind of protected him before the police and the ambulance got there. And I thought to myself, I want to live in a world where people do that for each other all the time. And she said, well, before taking this training, I never would have done that. I would have walked by and thought of him later in my day, or I would have called 911 and then gotten in my car and driven away. So it's interesting, Yeah. So those are some of my words. The second book is called The Arts of Contemplative Care. You can sometimes find a used copy on eBay. But this other book called Refuge in the Storm, is the subhead is Buddhist Voices in Crisis Care. And the author of this book, I believe, is doing we have a speaker series at the Sati Center on Buddhist chaplaincy. And I believe this speaker is the one that's coming up maybe next, Vanessa, or soon.
It was last week, actually, couple of weeks ago. He spoke already.
Oh boy.
But
okay.
But you could see the
Go ahead.
talk on YouTube.
YouTube. Yeah.
Okay.
Yesterday is tomorrow in my world. Yeah.
Right. Name of author. So it's a compilation, the book. It's a collection of essays written by all different types of Buddhist spiritual caregivers working in crisis backdrops. And the editor's name is Nathan Jishin, Jishin, Michon, Michon.
French.
Oh, maybe ancestrally. Aren't we all? Okay. Shall I start to talk about the program?
I was just going to check for
questions.
Yeah. So that was one. I'm going to type in the editor. Who has a good Buddhist name in the middle of his name. Okay, what's next?
What's next is a program. Sorry?
Go ahead, tell me what's next.
An overview of the program. I was going to talk about our training. Our trainings, plural.
Yes.
So one thing I love that Jennifer often says to describe the Sati Center's introduction to Buddhist chaplaincy, she says it's like going in an open top bus, you know, like going on a bus tour in a new city, and you kind of whiz around in a short space of time and you see all the major sites, and that sort of orients you to where you are and where everything else is in relation to everything else. So that's in some ways like how we think of this program. It is an introduction, it's a foundation. The field of chaplaincy, the skills of chaplaincy, the study is so vast. I would really go as far as to say it's a life's work. It really is. I think it's a never-ending learning and a never-ending study. But there are some sort of landmark skills and subjects within that. And then what we do over the course of the program, which lasts for 1 year, we try to give you an overview of all of that. Okay. And I think it's just enough that you can actually engage a lot of these skills and put them to use in, you know, if you are doing service work or in your day-to-day life or at your work or within your community, in your sangha. And then it's enough to also be foundational if you want to build on that and do further training. So I think it kind of serves both purposes there. As Jennifer mentioned, it started in 2003, and Gil Fronsdal often talks about how the idea for launching this program came after 9/11 for him. You know, I think that was the time for a lot of us of a sort of a reconsideration of our space in the world. And I think for Gil very much felt strongly that practice could go further, you know, kind of like I mentioned earlier, that practice would go outside of the place of practice, go further to really be of service in some way. So that was sort of the idea. And then Gil often refers to this program as a pyramid scheme of joy, which I think is lovely and observably true. So it's entering its 22nd year. This coming year, when that starts in September, will be year 22. So we are carbon dating you left, right, and center, Jennifer.
Right.
It'll be my 5th year with the program, and Jennifer's 22nd year. So it's been going a while. And so one part, like I mentioned, is that we kind of cover a lot of very foundational spiritual caregiving skills, like deep listening, like offering prayer, offering ritual, offering guided meditation, like, working in difficult situations, like crisis situations, working with grief, sudden loss, and facilitating ritual within our own communities, within our own Buddhist communities, for example. These are just some examples of some of the things that we practice and engage in. And then all of this, we are learning and looking through the frame or the glasses of the 10 paramis, the 10 perfections. Okay, so this is the dharma framework. And if you're not familiar with the paramis, they are generosity, virtue, renunciation, wisdom, energy, patience, truth, resolve, loving kindness, and equanimity. And so
Vanessa,
Mhm.
you're breaking up from time to time,
Oh,
or getting like that staccato. It's been
okay.
about every 2 minutes. So you might fiddle with something there on your end or talk a little slower. I don't know if that will help, but I just want to let
Okay.
you know.
I'm seeing some heads shaking too, and somebody saying that that's actually not, maybe it could also be your internet. Jennifer, I'm wondering, folks are saying it's working well. Oh gosh.
Drive all blames into oneself. That makes total sense to me.
But for what it's worth, we also see you and hear you. You're on that side of me. We also see you and hear you perfectly. So it's working. But do let me know, anyone, if I need to repeat something. So yeah, so we're using the framework of the paramis, and then every month we take one of those paramis as a theme, and we explore spiritual caregiving and maybe a particular spiritual care skill through the framework of the parami as well, and kind of bring them together. Yeah. So we promote, we take a lot from a very popular method of chaplaincy learning that's called action reflection. And there's some information about action reflection on the website. It's very simply the idea. It's an idea of a kind of very active way of learning, and it's why we require that participants of this program are doing volunteer work or some kind of service work in conjunction with the program, because you are learning through doing. You're learning through having these experiences. You are learning through connecting with the people that you're connecting with. And then you have those experiences and you bring them back to the workshops, or you bring them back to your one-on-one mentor interviews, or you bring them back to the writing work that you're doing, and you reflect on them, and you reflect on them deeply, and you reflect on them in the context of your practice and your relationship to the Dharma. And then what emerges is a sort of a wider look, at what is happening, and maybe new actions. As often we call it action reflection, new action. Okay, this is how we promote learning on this program. So it's engaged, and we really learn as a group. And I think it's a beautiful aspect of the program, and it's so important. So whether you're in person or online, we really, for the period of the year, and it's a 1-year program, we become a sangha. We really do become a group, and some very meaningful relationships form between the participants, often that last beyond the program. So as such, we're engaged with the group, and so we require everybody who commits to the program to really commit, to be there, to show up to all of the in-person workshops. If we're doing it online, to show up to the online workshops, to be, on camera, to be visible and engaged. in all of the workshops, we have one-on-one dyads or small groups, with discussions or just practicing certain skills with each other. Okay, so we're learning a lot from each other, and the wisdom of the group is really something. It's incredible. We have people coming from all different backgrounds, all different experiences of life. Like everybody gathered here already today. I'm hearing that you're coming from so many different places of learning and professional work, and it's wonderful when you just bring all that in, all that light, all that warmth into one space. It's magical. So it's sangha building, I would say, very much so. So the structure of the program, so we've got the two programs, like I mentioned. There's the in-person, which happens at the Insight Meditation Center in Redwood City, California. And that in-person cohort meets once a month, usually on a Friday, and the dates have already been set. So if you go on the website, on the sati.org website, and navigate to the Chaplaincy program dates page, you'll see that all the dates for the online program and for the in-person program are up already. So the in-person program usually happens on a Friday. It's one Friday every month, from 9 o'clock in the morning until 5 p.m. And the online program kind of splits the day in two. So because we've sort of discerned that spending 9 to 5 on Zoom would just be, yeah, you got it, Dave, and then some. And then it's a lot. So what we've done is we've kind of split that day in two. So we're still meeting on Fridays, but we meet twice a month. So 2 Friday mornings. So if you're living, we're still talking in Pacific time, those online classes start at 8 a.m. and they would run till 11:30. And then that would happen on 2 Fridays every month. Okay, so it's a bit more spread out, a little less kind of intense Zoom time. The in-person program also has a retreat halfway through the program, which is held at Insight Retreat Center in Santa Cruz, and that spans 2 days. Then the requirement for service work. So we've already talked quite a bit about the service work. We require that you do a total of 100 hours of service work over the course of the year. So that comes out at approximately just under 10 hours a month. And I'll say this, we've talked a lot about what might be the different options for service work, especially for people taking this class remotely. You might be living somewhere remote where it might not be so easy to find a traditional outlet for the service work. And so we can try and support you in the best way that we can. A lot of people, for example, this year have been working, I think we mentioned earlier, the San Francisco Night Ministry, who usually work with the unhoused people in San Francisco, but they also have a nighttime helpline, like a telephone line. So people who are living remotely and all around the world were able to be trained at the San Francisco Night Ministry to be telephone chaplains to people who, called in distress. That's just one example, but there's lots of ways to, go about thinking. If you have to maybe be a little creative in thinking about how you might offer your service out into the community in some way. If you are thinking of going the more traditional route of hospital, hospice, or jail, just to give you a heads up, the onboarding processes for these institutions can often be lengthy and give you a headache. So be prepared and start early. Like if you know that you want to do this program and you have some idea of where you might want to do your volunteer work, it's never too early to send in your application. Because honestly, on average, I want to say it could be 2 to 3 months before something's processed. So if you start doing that, when the program starts in September, you might not be doing anything until Christmas or January. And so there's been a few months where you've not had the opportunity to apply what you're learning. We also, the in-person program has organized field trips. I think what's happening this year, Jennifer, the participants are going to, is it San Quentin for the field trip?
No, it's south of San Jose, Soledad Prison, and they're visiting a mindfulness-based program that's imported to the prison population, and they're hearing testimonials of people's experience of mindfulness practice and actually ethical conduct and ethical teachings in daily prison life.
Mm. Yeah. So often there's a, for the people who can be in person, there might be an organized field trip like that. For people who are online, we very much encourage you to make your own field trips, and people, for example, at Christmas time might go and visit churches or, synagogues or mosques, or, join in other cultural or other religious celebrations, to just learn more about what's going on around them. I've just realized that actually there's a little diagram that I can share on the screen that might help illustrate a bit more what I'm talking about. This is you see that? This is a page from the website, from our course description page, that just sort of illustrates nicely, a bit more visually, what I'm talking about, the different components of the program. And this is pretty much true for the online and in-person training. They're both structured in the same way. So we've talked about the field trips and we've talked about the workshops. Then in addition to that, we've talked about the service work. And then other components of the program are assignments, so reading and writing. There are about 1 to 2 essays per month to be submitted. And usually you will also receive feedback on these essays from the faculty. And then there's about 100 pages of reading per month as well. Okay, so this is a requirement and it can be quite a lot of reading. So just to sort of prepare you for that. For some people, that's very sweet and they like to read a lot. And, for other people, that can be a bit more of a burden. But there's quite a bit of reading. And then as a group, the group size is usually, it could be anything between 12 and 24 people. A lot depends on how many applicants we get, how many people are accepted, appropriate for the program. So anything between 12 and 24. But within that larger group, then we make smaller groups of usually about 4 people. And you would meet with your small group every month, either online or in person, however that works out. But you meet with your small group every month. And you also get put together with a buddy, just somebody who's like your person, like somebody that you can refer to and meet with also regularly. So you sort of end up kind of co-supporting each other through the course of the program. And you meet with your buddy every month. And then every 2 months, you also have a meeting with one of the faculty members in a mentor interview. And during that time, you can discuss anything from how the program's going to any details about your service work, all sorts of things, maybe, areas where you might be stuck. This can be a very powerful time to talk to a member of the faculty. And then finally, like Jennifer mentioned, we have this new thing that started this year, the speaker series. So the Buddhist Chaplaincy speaker series, maybe some of you have already been aware of this online. It's, part of the Sati Center's program. But we have somebody who is working within the field of Buddhist chaplaincy or chaplaincy generally come in and speak once a month. And this is, I think, invaluable exposure to people who are actually working in the field, hearing about what the day-to-day is like for them, what are the highs, what are the lows, what do they have to transmit? I mean, every single talk we've had so far has been absolutely fascinating. And as students of the program or students of the program then actually get to spend some time with the speaker after the event. So it's an online event. So anybody who's either in the in-person program or on the online program, we all come together with the speaker after the event, and you have a little time with them to really directly ask them any questions that you have. So you might be interested in their particular field or, something that came up during the talk. So that really is, it's a wonderful time. And it's a time when both the programs come together in the same space, which is lovely. So all in all, with all those components together, what people often ask me is, how much time does this actually take up? You know, how much, I've got a part-time job, or I've got a full-time job, or, how am I going to be able to fit this into my life? And here's what I say, adding up all of those components, I would say that, for it to really be spacious, for you to really be able to absorb the advantages of doing this program, I think you'd want to have a good 5 days per month to be able to dedicate to it. I would say 5 days, 5 sort of full work days, as it were. And that would include the service work, and that would include the time that we spent together in the workshops, and then all the extra assignments as well. And I'm sure there's people who can do it in less time and people who might need a little more time, but on average, I think 5 days is about the mark. I'm going to have a quick look at the chat at this point.
I'm going to add something while you look at the chat. One thing about the Sati Center Buddhist chaplaincy training that both Vanessa and I teach, and chaplaincy in general, it is the realm of the sacred, God, higher power. Insert your synonym here. But if you're somebody who's vehemently agnostic or atheist, and that's a cornerstone of your dharma practice, it's not a cornerstone of spiritual care or chaplaincy. So you can be prepared for that. Like we talk about prayer, and people are like, well, we don't pray as Buddhists because we're Buddhist, and which is inaccurate. There are Buddhists who pray, and prayer is a part of their practice. So you may be in shock, like, wait a minute, why are we talking about religion and spirituality all the time? Well, it's a cornerstone. Yeah. It's a cornerstone. Yeah. And a lot of people have come to the Dharma because they have left whatever religious tradition they were raised in. And what we have found is that it can be very healing to take this course for people to re-enter the realm of God and the sacred and the holy from a Dharma perspective. Yeah. And that, because what happens is when people leave their family of origin, religious tradition, they usually stop maturing in their understanding of that tradition. So if you left when you were 12 or 14, then you have a 12-year-old's developmental ability to understand the tradition. Yeah. And if you had stayed, you would have matured in your understanding. So I usually say this at the first class, like, this is the realm of religion and God, and be ready, or at least willing to re-examine why you are an atheist or an agnostic, or have left the religion of your family of origin. It's not like a prerequisite that you understand that, but it's relevant to your formation, your development as a chaplain. And there's our guest speaker. There's Ram. Hi, Ram. Welcome.
Nice to see you, Ram.
So beautiful to be here with all of you. And
yeah.
2 of my favorite teachers on top of that.
Well, thank you for coming. We have been talking about what is spiritual care, what is chaplaincy, the history, this current training. We've just been talking about the Sati Center's training. So we've kind of teed you up to go in depth to your experience of like what it was like at the beginning,
Mm-hmm.
what it was like in the middle, what it was like to complete,
Mm-hmm.
and where that's led you would
Yeah.
be great.
Yeah.
Yeah. Yeah.
Awesome. Is this a good time, Vanessa? Yeah.
I was going to just say a little more about applications for
Yeah.
the pro. Oh,
Yeah.
Jennifer's got fireworks behind her right now. What
Okay.
happened there?
What?
All right.
Um,
Yeah,
so
absolutely.
I'll finish talking about the program, and
Okay.
then I think it'll be a good time.
Beautiful.
Thank you, So I was just going to add a few more. These are just practical details. And one thing I was going to mention is that on the website, you can see the faculty. You can read about the different faculty members of the two different programs. So Jennifer and I kind of do a little like crossover, or we have been this year, between the two programs. But in general, Jennifer, along with Gil Fronsdal and Paul Haller, teach the in-person training. They are the three core faculty for that training. And then for the online training is myself, Trent Thornley, and Dawn Neal. Okay, so I won't do any of them justice by talking so much about them now, but you can read their bios on the website, and you'll see that all the faculty come from different backgrounds. Like Jennifer mentioned, from Zen, from Theravada. Trent is actually he practices in Tibetan Buddhism. He's also a Christian minister, and he is the director of the San Francisco Night Ministry. Dawn is the guiding teacher of Insight Center in Santa Cruz. Paul Haller is a guiding Zen teacher at the San Francisco Zen Center. And Gil is the guiding teacher at Insight Meditation. So kind of come from all over. And so varying backgrounds and sort of degrees of different kind of corners of experience there, I would say. The cost of the program is on a sliding scale. It's from between $2,000 and $4,000 for the whole year. And people often ask, well, how do we calculate that sliding scale? And we say that that's completely for you to decide. Okay, that's completely for you to decide where you fall, whatever is comfortable for you financially, whatever you feel you can give between those two figures. We do also have a work scholarship or several work scholarships available. If that's something you'd like to apply for, do let us know. And there is an application form for that on the website, and that gives a 50% discount off the fees. And in exchange, we ask that you kind of help us out with a few administrative things regarding the program over the course of the year. Okay, and then finally, the application. Because I know now you're all like, yes, let's do it. We're going to apply. It begins really soon. So our application window, if any of you have ever sort of followed us in the past, you'll know that usually applications happen during the summer, but we've decided to bring them forward a little bit this year. And our application window is going to open in May. It's going to open on May 1st. And that means that we will start looking at applications from May 1st onwards. And our strong recommendation is please don't send in applications before that date, okay? That it'll just be confusing and troubling. So please send in applications from May 1st onwards. And we will start interviews probably within 2 or 3 weeks of that, that first opening date. And we normally accept participants into the program on a rolling basis. Okay, so we'll kind of go through the process of reading the application, and then you would also need to provide a reference from preferably a Buddhist mentor or teacher. And then you would also interview. That's the 3 parts of the process. There's the interview, the application, and the reference, okay? Oh, and there's an application fee as well of $100. So that the application fee, the reference, and the application form all need to be in, and then we would contact you about an interview, okay? And then if all of that is in place and, we decide together And that's really what a lot of the interview is about, is just trying to figure out, is this really the right thing for you? And is it the right moment in your life to be doing this? And, is this really going to be a good fit? And if we do discern that, and we would offer you a place on the program, and we will do that on a rolling basis until the program is full. So for that reason, we can't give a closing date for the applications, because we don't know how long it will go on for. So I'd say if you're really set on doing this and starting next September, or this coming September, then do get your application in earlier rather than later. The application form is a very rich experience, I'm going to say. It is, maybe some of you have seen it already. It is multiple pages long, and it really invites you to go into the hows and wheres and whys of the reasons for you wanting to take this program. Okay, it definitely, asks some quite probing questions, and it invites you to have, a good hard look at yourself and why you want to be doing this. And I think it gives you a good idea of the kind of territories that we cover on the program. So maybe you start filling out the application and you're thinking like, I don't feel comfortable with this, or, I'm not sure I'm quite ready to talk about this aspect of my life. It could be a good sign that, maybe it's just not the right time for you right now. Maybe it's just not the right program. So it's a really good sort of litmus test, starting with the application. And also, we say, and I really feel so strongly about this, going through that process and filling out the application really is the first step of the program. It starts there. It really starts there. It's quite an involved process. So I invite you to look at it. At least you'll see there's let me put in the chat the link to the page where you can see all the information about enrollment and application.
And then we want to pass it over to Ram.
Yes. There. You'll see that normally the application form is on a Google Forms document, and it's kind of, you've got to fill out one page before it'll let you go to the next page. But there's an option in there to download a PDF first, so that you can, we would recommend doing like a rough version on using the PDF, or doing it in Word or something, and then copying it into the form when you're ready to do so. That's just a little insider tip. Okay. All right then. So Ram,
Beautiful.
thank you so
Thank
much
you.
for joining us. Thank you. I'll just quickly say, I'll introduce you, that Ram is a former participant, a former student of the program, and has since gone into work in prison chaplaincy, and is a faculty member of the Eco Chaplaincy program at the Sati Centre. So we're delighted to have you, Ram, and we would love to hear from you about your experiences on the program, as well as, what surprised you and what challenged you.
Yeah.
Don't pull any punches. Let them know how it is.
Yes, thank you so much. It's wonderful to see you all. So I'll use my first person, that way I can truly be expressing my experience in as much detail. Feel free to ask me questions. So I've been in the Buddhist path about 14 years, something like that. And so around 8 years ago, I retired early and wanted to really think through, look, Buddhist practice can be all about me. I need to be of bringing some value or service to someone else. That was the first thought. I didn't equate that to chaplaincy at all. But I was also a deep lover of nature and the ecological issues. So I first took the classes that the Sati Center offers on eco-chaplaincy. That got me grounded, that got me going very much. But the Buddhism and ecology resonated very well for me. But the chaplaincy part became interesting. I was more and more curious. So I started to take the second chaplaincy program, the one we are talking about here, Buddhist chaplaincy training. That absolutely just, boom, the light bulb started to go on significantly. Yeah. What that means is it's a process of self-discovery for me. I learned more about myself and not just applying Buddhist teachings, but there are areas it's pretty much what is my true nature? How do I really bring this? When Jennifer teaches, how do you bring your presence to a caregiving situation? I remember those lectures and classes distinctly well. What does that mean? What is my understanding of suffering of others? And how does that relate to my own suffering and my own experiences? And how can I be there as a humble listener in that environment? And what can I do and what can I offer? Right? That's the kind of introspective questions that started to come for me through the process. And every month it grew in, and my service attempts, I try to call, as Vanessa said, hospitals and hospice centers and everything, and some of them have a longer lead time. And this was somewhat during COVID was not completely done with. Many hospitals had constraints or they're limiting more and more in-person engagement. And I was also interested in homeless shelters and prisons, the marginalized community or underrepresented community from a caregiving standpoint. So I had the opportunity at the CIC ministries who do the chaplaincy for prisons and jails in Santa Clara County. Yeah, I started this, or where are we right now? Somewhere at the end of 22. I think I graduated in the 21, end of 21. I graduated in the year 21. And what happened at the time was when I went to the jail, all kinds of preconceived notions, biases, fears, they all started to come. Very soon I felt much more comfortable, right? The thing I learned more through the process is the things that the chaplaincy training goes through, every one of them is very, very applicable in the prison setting, okay? Initially, I thought I was going in as a Buddhist chaplain. I'm going to target Buddhism and mindfulness, so on and so forth. And as the program, the 11-month program started to go, and suddenly the notion of interfaith grew on me. So Buddhist chaplaincy is something like a cloak I wear, but who I am caring for is people of all faiths, right? We are not limiting ourselves to Buddhist alone, okay? To make the long story short, basically, after about a year of volunteering, the organization hired me as a staff chaplain. I'm not a volunteer anymore. I'm a chaplain. The Buddhist chaplaincy training gave me enough credentials and my volunteer hours to qualify me to get the job. Okay? And what this allows me is really go in and engage with the inmates and engage with the inmates' families, because caregiving is not specific to the inmates alone. It is the deputies, it is the co-workers, it is the hospital staff, or rather healthcare staff. It's inmates' families, and it just becomes a kind of a network of all supporting casts that they are there. And it opens up how we engage with the entire cast from a caregiving perspective. Okay. And it became, I call it more and more fulfilling for me, but more than fulfilling, it became a very meaningful part of my Buddhist practice. Okay. I can keep loading the semantic memory with all the knowledge I want. I can keep taking classes, so on and so forth. There is something about part of my mind and my brain where I wanted to go into is, where is that heartfelt fulfillment, and where is that most meaningful and what I call that fits my capacity, that fits my caregiving profile to actually be of value to someone else. Okay. So I'm struggling with expressing, because it's such a beautiful feeling at the end of the day, right? I can read the books all I want at the end of the day and really be amazed at Buddhist teachings, like we all are generally. We listen to Gil Stocks and so many other teachers, and we are inspired by them. But when you engage in this work and really work on this, and I had a cheat sheet as we went through the Buddhist chaplaincy training, where before I left the car at the parking lot, I went through each one of those things. Okay, Notice your presence, notice your self-care, notice exactly your listening skills. Are you opening your heart? Are you processing with your mind? So these are all my cheat sheets that I developed through the program. And as I got in one by one, it started to make sense. And as a staff chaplain now, I'm directly responsible for about 800 inmates. I'm the first level chaplain for them. It doesn't matter which faith, everything that they have a request for comes through me. In addition, given the Buddhism and the mindfulness background, I also teach mindfulness meditation in the jails, both in the main jail and the Santa Clara County Elmwood. Okay. And today, I've been here now about 2.5 years, a little more than 2.5 years. There are over 350 active meditators in the jail right now. Okay. And that's amazing when they come back. And that's where, Ram, can I have a one-on-one with you? They ask for a time. And I'm also delighted through the Buddhist Chaplaincy program over the last 2 years, they are supplying volunteers into the program. If anyone wants to get into the program, want to volunteer here, I welcome you. The opportunity can be 1 hour a week, 2 hours a week. You choose what you want to do. And we'll provide the training, we'll provide the clearances, we'll provide whether you want to be in the women's jail or the men's jail, whatever your comfort part is, we'll absolutely walk you through. And this year's class, 2 of the people are doing the combination of one-on-one chaplaincy sessions as well as teaching mindfulness meditation classes. Okay. And what I found out was this deepening skills that I'm having this opportunity, learning more about myself, engaging day to day. This is a spiritual unfolding process, and there is no limit to this. I work with Muslims, I work with Christians, I work with Jews. Friday, I was with the Rastafarian. And as Jennifer said, not a day goes by I don't pray half a dozen times, if not more. And many inmates put in a request, chaplain, can I just have a prayer with you? That's all they want. Okay, that's an entry point, because in the prison environment, most of them don't feel comfortable about opening up. It will take 1 or 2 visits for us to earn their trust, and they can open up. And once they are there, it's delightful to have how much conversation can go on, how much we can make them feel at ease. And they are fighting one of the biggest negative forces in human existence, in my view, that's helplessness. That's what they're there for. Okay. And we are there as a spiritual friend. Sometimes I worry Buddhists and chaplaincy, it sounds like a redundant thing. Buddhists are natural chaplains, but at the same time, here we are actually seeing a person in their own realm suffering. And that's an important factor, because in the jail, out of 4,300 people or so that are in Santa Clara jail, or slightly less than that, and almost 90% of them are still going through the trial, and they are not tried yet. So they are not guilty of anything at this point. But our legal system is so convoluted, it takes over 2.5, 3 years to go through the cases. There's one guy, he's been incarcerated for 9 years. His case is still going on. And majority of these guys are there because they can't afford a bail, and they don't have anyone family supporting them locally here, whatever number, and the broad range of reasons. Your heart breaks hearing the story, and it heals. Every day is a heartbreak, and then it heals, and its capacity grows. Right? And you learn about when there is a self-care portion in the chaplaincy training. And I just glazed over it at that time, but soon it became, wow, this is so important in the process before and after, right? So I kind of built my own ritual after that, because as soon as I park in the car, I do 20 minutes of metta meditation. And then I have a bird seed in my car in the trunk, and there are a couple of county parks I drive through, and then sit there and process my day, throw some bird seeds, watch some birds. And when I come home to my wife, I want to be as normal as possible. Right? It works on both sides. Okay, because when one of the lines we use in chaplaincy is, when we are with the inmates or care receivers, we want to bring what is best of us, not what is left of us. And that's an important point for me to always think about. Am I in the best possible mind and heart to be able to be of service to the person? So no inmate is a checkoff item. I need to cover 4 or 5 people today, therefore I'm going to walk by and say hi. No, right? So the elements that the program taught me gave me the depth. And then the depth keep going deeper and deeper as I engage with people and found out the relevance of the teaching to the applied opportunity that I faced. Okay, one-on-one setup, you bring certain aspects of your chaplaincy skills. Group setup, you're going to bring a different set of chaplaincy skills. Either way, what are your listening skills, and what's your as my DNA worked in high-tech industry for 35 years, I was pre-wired strongly for fixing things. Okay, I learned so much about myself, how to shut that part off completely. Right? Initially, it was hard, but over time, I grew into this. And that's why when I onboard a volunteer, I go with them for first 3 to 4 months. They shadow me in the classes. I work with them on one-on-ones. And after that point, they're beautifully unfolding themselves and offering the care to the community that they are. Okay. So I'm half and half. Half my life right now is on eco chaplaincy, another half is on the prison chaplaincy. In the eco chaplaincy, it's largely about collective crisis. It's not much one-on-one. There are climate activists to different type of suffering, and they're facing climate change that's internally and emotionally affect them in so many ways. We bring the same set of tools, but to a different environment, but we add some ecology-specific rituals and some practices and certain ways of handling the grief. Okay. And one thing this program teaches, I tell you about, the notion of grief as in Western world, what we understand is very flimsy. That's what I learned. But when you actually go see an inmate and work with them, you understand the depth of it. The comment I want to make is, in my schedule right now, every week, at least I'm going meeting with one inmate and passing on the message, one of their loved ones passed away. And the person is hearing that for the first time from me. Okay. Mother, father, grandfather, grandmother, son, daughter. It just doesn't stop. Okay. And that's where the helplessness part really hits hard. And my own personal experiences overlap. I bring that with me because there are certain things that shape my way of handling grief, and sometimes grief and guilt come in as a soup. These people have that regret and remorse in many of them, right? And you are standing there and communicating the notes, watching it unfold, and be there for them as a chaplain. I don't want to call this as a painful experience, but it is a much deeper human-to-human connection. And that really makes it all worth it. Okay, let me stop there unless you have any questions on top of this.
Gosh, thank you, Ram.
I'll put my email here. If anyone wants to explore or find more about prison chaplaincy, send me. And if anyone wants to learn about eco chaplaincy, we had a similar session a while ago. I put them here as well.
Thank you, Ram, and thank you for that offer as well.
Yeah.
Thank you. And is it true that I think your eco chaplaincy program this is currently, you're taking applications at the
Correct.
moment?
Yeah.
Right?
Yeah.
Mm-hmm. Wonderful. Thank you. I see Kate. Your time has come.
Thank you. Lovely. I think this is a question really for any of you, Ram or Vanessa or Jennifer. So I am a certified mindfulness teacher, and I'm a Buddhist practitioner, and I have a long history of volunteer work just because that's something that's part of my ethos. And I've taught in hospitals and schools, and I say teaching because that's what I consider what I've been doing, sometimes for pay and sometimes for volunteer, often for volunteer as well. And I see, especially when I offer it as volunteer, that this is filling a need that may be considered spiritual, but that's kind of a taboo word in a lot of those settings. What enables me to go into a school and offer mindfulness is that I'm not bringing any trappings of Buddhism. I'm not even using the word spiritual a lot of the time. So whether with children or adults in these different settings, and I'm curious, I guess, first of all, how if I were to be in the program and do volunteer work in these settings, how, I mean, it would be a new learning curve for me, I guess, how to navigate that. And then also a deeper question maybe, or a more general question, which I think also was brought up in the chat early on by someone else, is this word spirituality is very much in the culture, and people use it and mean very different things from that word. So it's a word I sort of, although I consider my Buddhist practice deeply spiritual, I tend to use the word sacred more just because I feel like it's not as overused. But I'm just curious if that's addressed in the training, or how that might be addressed. I don't need an answer to the question, but just more like, is that something that's sort of talked about both as, you know, how we use language, but also specifically how we use language in these different settings where we might be volunteering, where we want to make the teachings accessible, and the, not just the teachings, but the practices, and just the, you know, being available to people in this way. I guess that's, I'm not being very, I don't know. I hope I'm articulate enough to make sense, but any thoughts you all have, I'm curious to hear about. Thank you.
Well, I can jump in, and I'd love to hear from Ram and Jennifer as well. But I'll say this, Kate, that I think one of the things that we really practice with, or that, you know, one of the things that we really shine a light on during the course of the training is the skill of appropriate response in a situation. You know, so what as undefined as many of these terms and languages that we use are, you know, I think equally a person's inner life is as uncharted and as often, you know, as unarticulated very often. And so what are we using, you know, what in ourselves are we using to be able to connect with that, facilitate that, you know, appeal to that, bring that out into the light in some way, and what's appropriate in the moment. So you know, you have everything that you've learned and you've trained with in your life, and how in this particular moment is it going to show up, and what guise will it take, and what language will it use. So I think that it's more the preparedness for that we go into. And then Ram and Jennifer, I don't know if you have a perspective on that as well.
Yeah, that's beautiful, Vanessa. In many cases, we don't know what their faith is or where they are there. That's not my intent either. So I'm bringing my healthy curiosity and open-heartedness to meet them where they are. Okay, and let it unfold. It's not like a rehearsed or a prepared practice. And one thing in jail, if someone's demographic is between 18 and 30 or even 35, they don't particularly have a religious practice or spiritual practice. They knew when they were young, they went to church with their parents or whoever, but nothing beyond that. They're discovering about God and spirituality in the jail setting for the first time. So they are happy that you're there, just listening to them. Okay. So when I pray to them, one of the questions that often comes up is, who is your God? If they say it's Jesus Christ, you respect that. Jesus Christ is your God. They ask me, who is my God? I explain to them, my version of God is all of nature. So why don't we keep our own gods in our mind? Let's pray together and say, dear God, and go through the prayer together. Unlike in other settings, you can't hold them, you can't there is a jail rules. We can do the fist bump at best, but we certainly work with these constraints to see the God in our own way and yet recognize and appreciate. The second thing in the mindfulness meditation, when you teach about adding affirmations to the practice itself, these are a lot of pretty much beginning meditators, and they need all the tools they can to keep the focus. I say, breathing in, say, God loves me. Breathing out, I'm worthy of that love. And they can morph it. Breathing in, Jesus loves me. Breathing out, I'm worthy of that love. So you can bring in whatever faith they are in using the tools we have and make it relevant for them.
Lovely.
I have a question for Ram. You come across as pretty certain and pretty clear. Have you always been certain and clear? Is this a skill set you brought from your other work life? Or another question would be, have you ever doubted your ability to do this?
The biggest transference that happened is from my mind to my heart. Okay, I was always a confident person. Okay, and the part of confidence is I don't mind failing. Nothing bothers me about failing. Absolutely nothing.
Have you made any really big mistakes at the prisons?
Oh yeah, many. Right. I literally used the word, I pissed off a deputy. Right.
Oh, okay.
You don't do that in jail, right? But I'm ready to apologize, and I'll go to my boss and tell exactly what I did. I don't need to hold back. And this is what I learned from this one. I'll do my best to not to repeat this.
Okay. I'm just curious. Yeah. Yeah.
Right.
Yeah.
I mean, out of all the Buddhist practices for me, the teachings on Brahma Viharas is about as relevant as I can make it for the teaching. Can I see goodwill in every opportunity, not just the subject and object? Can I bring compassion into every opportunity? So we are so hung up on even the word love, we attribute to subject and object. What if love is just the process with which we do everything? Right? And then I don't need to, I feel very free that way. I don't have anything, I don't have beliefs. Yeah, I have certain beliefs, but I'm not tethered to those beliefs. There's a sense of freedom that comes with this Brahmaviharas practice for me.
So another question. So you've been doing this now for a few years, and our audience today are people who are thinking about doing this. And so what do you wish you'd known right before you did this that you now know?
Not have fear of the unknown. Okay, because I had my own notions on being in the prison environment. It not so much with me, my wife and my kids, my mom at that time, they were all really, what the heck are you doing? What the heck are you doing? Are you going to be okay? So they keep adding all those things on me, and their welfare becomes objective. I can't ignore that. Okay, deal with it. I'm going to do this job. No, that's not me. I needed to make sure this is essentially what it is. So bottom line is, I could have done a better job of telling them this is, you can ask for a safer place because on a per capita basis, there are 2,000 cops there.
Right.
Right. So it completely changed my view. That's one of it. Right. The second one I would have had is while I went with the open mind in the program, towards the second half of the program, the whole notion of my Buddhism to interfaith grew on me. I wish I took the interfaith approach earlier in the program. Because my initial part of the program said, I'm going to be a Buddhist, I'm going to care for Buddhists. Okay. And if you remember, we are probably in the March, April months or so when the notion of interfaith, at least as I remember, how that unfolded for me. And those two come to my mind.
Thank you. That's very interesting. I've never thought that, and that makes total sense to me. That the people around you are impacted by your decision.
Right.
And to not you know, just, yeah, it makes total sense. You know, like I remember a supervisor telling me once, like when she was in training, she would come home every day and practice a new skill. And
Mm.
her partner finally said, I'm done with you practicing on me. Go find somebody else to practice on.
Nice.
That's so funny. Yeah, it's true. Yeah, yeah,
Yeah.
yeah. Thank you, Ram, for your dedication. And thank you for paving the way for prison dharma. Current students, past students, future students. I know you spend a good chunk of your energy daily and weekly, cyclically. So thank you for your practice. Yeah.
Look what you did, Jennifer. This is the my going back to pre-Buddhism, my Vedanta days. Anyone comes with you with a praise, you deflect it back to the teachers and the lineage
Okay.
of teachers called Guru Parampara.
Okay. Yeah, I have nobody but to blame but myself. Yeah, you know. I think it's a great, you know, in closing thoughts. We're out of time. You're welcome to be in touch with us with specific questions. If you aren't certain, fill out the application and send it in. And if you're not certain about this choice, put that in your application, and then we can talk about it at your interview. You know, we can talk about it at your interview. Is this the right time? Is this the right thing? You know, like, so you're all in discernment, and that's what brought you here today. And so I know that discernment is a zig and a zag and a little tail chasing, and that's appropriate, you know, so it's appropriate to question. And hopefully we've given you more specific questions than you had prior to today. And we'll follow up with all of you with some follow-up links, including Ram, if you want to send one to Vanessa, I don't know if you have a link for people that are interested. Not now, but in the training. Yeah, I wouldn't even know how to get somebody in touch with you besides.
Yep, Ram
email.
shared his email
Oh, great.
already.
Okay.
And I just shared the bct@sati.org. Sorry, I just had to, I think I'm getting tired. I just had to retype it like 3 times. But bct@sati.org. So that's for any other questions that we might not have had time for today. Please don't hesitate to be in touch.
Okay, great.
I'd like to say just before we close out, thank you everyone so much. I personally feel so energized and encouraged to see so many people, you know, just coming in to find out more. And it's wonderful. And I have so much gratitude, Jennifer, to you, you know, for the 2 decades that you've put into this training already. And Ram, thank you so much for coming in and really speaking from the heart. I feel inspired by the work that you're doing. And really, I was quite speechless. And I love the image of you going to feed ducks after you've been to the prison before you go home. What a buffer. Beautiful. All right. Anything else, Jennifer?
There are unseen people that helped us gather today. Yeah, Gil Fronsdale, Paul Haller, the alumni of this program, the person who manages the website, and the registrar. So these
Rob.
these unseen hands, let us acknowledge them well. Yeah.
Yes, indeed. Thank you, everybody. May the merit of our time together benefit all beings. Thank you. Jennifer and Ram, if you could just stay back for a couple of minutes, if that's possible. Thank you. Otherwise, bye-bye.
Bye, everybody.